Good morning, everyone. Today we are going to start the new unit of internal medicine, hematology. And hematology is quite interesting. What is like hematology? First of all, the definition simply it's the branch of medicine which deals with all the diseases, conditions, and what you can say their management related to the blood. And there are many conditions which can cause some blood diseases like red blood cells are there, white blood cells are there, platelets are there, bone marrow is there, spleen is there, okay, coagulation, all coagulating factors, and they are made by liver. So of course, uh, all the conditions which are related to that. Simply when the RBCs they become less, we call that condition as anemia, and when the RBCs are increased in the body, we call that condition as polycythemia. Same thing with platelets, thrombocytopenia or thrombocytosis, and sometimes there are pathologies with the bone marrow, like the bone marrow failed to make any cell line, or the bone marrow is overproducing some cells, which happens in blood cancers, or what we say leukemia and lymphomas. So all this you can say um, things, tissues, blood, bone marrow, spleen, liver, because liver make the clotting factors, and lymph nodes. They play a role with hematology, and this is a very interesting field because even this one, when we diagnose the conditions by looking some clinical features, that's how we diagnose anemia. That's how we not diagnose, but like that's how it make us think that the patient may have anemia, or for example someone who is coming with um, lymphadenopathy, or his lymph nodes are swollen in the body, so we can think of lymphoma if someone is getting too much infections, someone is getting too much bleeding from different sides, or someone who is getting anemia, so we can think about leukemias. Okay, so of course when we will keep discuss the things in detail, you would have an idea what we are talking about. So the people who specialize in this field are called as hematologists. Okay, and people think like the hematologists they just work in the labs. It's not like this. They don't just work in the labs, rather they have physicians. Okay, of course, like the physicians, they see the patients as well as they work in the labs, and they work in close association, or a close coordination. There is too much coordination between uh, the hematologist as well as the pathologist, and some of the people you can say who specialize, like the pathologist who specialize in diagnosing hematological condition, we call them as hemopathologist, okay, or hematopathologist simply. So all the bleeding disorders, all the malignancies, all the anemias, leukemias, lymphomas, everything, they are covered by hematology. So, of course, like today is the first lecture, and we are going to cover a lot of things in this one. So, uh, just to start with, like how the thing goes, by the way, there is a lot of things we have to cover in this one. Like the cell lines, or what is hematopoiesis. Again, like this is I'm going to talk very 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 little about this one, because you can again refer your Guyton, okay, to what you can say, to read these things in detail. Okay, so if you know what is hematopoiesis, poiesis, okay, so hematopoiesis, like what we study um, in our basic sciences, how hematopoiesis occur. You know that there is a hematopoietic stem cell, and which is the one which give rise to like three main things. So what happened that there is a um, I don't know what happens with the color, so wait. Okay, so what happens is like there is a hematopoietic stem cell, okay, which basically give rise to um, the precursor, okay, so they give rise to the precursor. So what is precursor? Like you can say the initial cell. So the three precursors or the three cell lines which it gives rise to is one is called as lymphoid precursor, one is called as myeloid precursor, and one is called as, you can say, mega karyocyte precursor, or to make it easy I will write it as erythrocyte precursor cells. Okay, so these are the precursor cells. What happens is like the lymphoid, this is lymphoid, sorry. So the lymphoid precursor cells are going to give rise to lymphoblast. Okay, and the lymphoblasts are the one which will go and they will be forming, further they will be forming T cell and B cell. Okay, so and then there is myeloid precursor, and what myeloid precursor cells they do is like they give rise to myeloblast, monoblast, as well as they can give rise to uh, erythrocyte precursor as well. So myeloblasts are the one which give rise to basophils, okay, as well as uh, eosinophils, okay, and neutrophils. So these are the cell lines I'm talking about, and then there is what you can say, erythrocyte precursor or megakaryocyte precursor. So simply, this erythrocyte precursor or the what you can say, the megakaryocyte precursor, they give rise to megakaryoblast and proerythroblast. So megakaryoblast, they give rise to, of course, and platelets, and whereas you can say the erythrocyte precursor give rise to RBCs. Okay, of course, like we have to add here mega karyocyte. Okay, so like these two cell lines, of course, megakaryocyte will give rise to platelets, whereas erythrocyte will give rise to RBCs. What is this? These things, like why I'm talking about these lines, because all these lines are formed in by what you consider hemopoietic stem cell. So of course, like there are some terms which you must be knowing. And what is erythrocyte? Of course, these are the RBCs which carry oxygen, all over the body, and it have hemoglobin, which is the oxygen carrier simply. And like what is neutrophils? These are the cells, which are circulating in the body, or you can say these are, many people they say, they are the police of the body. Whenever there is any infection, anything, neutrophils are the first one which will go and like plays the role in immunity. So simply, they are a very important part of innate immunity. Okay, and they are the main cells in inflammation. And eosinophils, of course, like uh, they are named eosinophils because of their color. And but remember, like eosinophils are the cells which play two important roles. One is their action against the parasites and allergies. Like for example, whenever there is any allergies in the body, eosinophil cells will be raised. Whenever there is any parasitic infection in the body, eosinophils will be raised. Basophils, again, they have almost the same function, you can say, like eosinophils. They are very less in the body, but they again play some role in allergy as well as parasites infection. So this lymphoid cells like T cells or B cells, like neutrophils, they are the part of the innate immunity, whereas lymphoid, they are the part of the adaptive immunity. And monocytes are the cells which are also involved in innate immunity, and they are the one which can differentiate into macrophages as well as dendritic cells. Platelets, as we know, they are the cells which maintain the hemostasis. Whenever there is any cut in your body, whenever there is any bleeding site, what happens is the platelets are going to form the plug, okay, or they are the first one which are going to help in stopping the bleeding, uh, the first step, and then of course, like, the clotting factors will come and all the clotting cascade will be started. So simply, when we talk about the blood, guys, basically we are talking about everything, like what blood is made up of. So remember, guys, whenever we talk about blood, uh, what we are talking about is uh, like basically it's all the cells. What cells? Of course, RBCs, okay, as well as WBCs, as well as platelets, okay, and we mean to say plasma, okay. So what is plasma? Uh, like what they do, by the way, they take the blood, they centrifuge that, and different portions of the blood, they are separated by that. The cells settle down, and the plasma, it is separated up. So simply you can say this is the liquid portion of the blood, okay. And basically in the plasma, which is the liquid portion, uh, like what it is made up of course it's water because it's liquid. Then there are many proteins, and when I say proteins, I mean to say all the coagulation factors and all the immunity things, okay, and everything. So immunoglobulins are in the plasma. So all these things, are in the plasma. So now there will be one term which will come, that is called as serum. And many people, I think, they don't know exactly what is the difference between plasma and serum. So what happens is, if you will take out few things from the plasma, we call this thing as serum. So serum is basically plasma minus, okay. So from plasma, if you will take out clotting factors, okay, and fibrinogen, it is called a serum. So serum is simply plasma, but they take out clotting factors as well as fibrinogen. What is fibrinogen? Of course, like we are going to discuss what is fibrinogen. Okay, so okay, just help me settle down the things. Okay, so plasma is clotting factor. Serum is plasma minus clotting factors plus fibrinogen. Or you can say, what is plasma? Plasma is simply serum with clotting factors and fibrinogen. So all these things, uh, uh, like they are present in the blood. So there are many cells which are produced in our body, okay. So daily, there is production of hundred thousands of cells in the body. And because hematopoiesis, which is the formation of the blood, it is continuously occurring in the body. And the RBCs, they have the lifespan of around 120 days, like two basic things. That's why I don't want to waste time in that, because you guys have already covered these things in physiology. So simply, yeah, uh, like our cells in the body are continuously replaced. Our RBCs, for example, they have the lifespan of 120 days. By the way, it's not exactly 120 days. It is from 90 to 120 days in a normal person. Uh, Neutrophils, they have a lifespan of just around 1 day. So of course, like they must be produced every day. Same like this platelets, their lifespan is around 7 to 10 days. And lymphocytes, because there is memory lymphocytes as well. So some of the memory lymphocytes, of course, they remain in the blood for all the life, you can say, or for many years, because it is the one which is providing you the immunity against certain conditions. So uh, like this is all about blood, and where the blood is formed, of course, in babies, of course, it's the process is called as hematopoiesis. In the babies, the hematopoiesis occur in the long bones and like at many areas. But as we age, our hematopoiesis shift towards the center, move towards the center, and in the adults, most of the hematopoiesis occurs in, you can say, the pelvis, the sternum, the vertebral bodies, central things, cranium, things like this. Okay, so guys, what is the importance of this studying the blood is simply, whenever we study any condition, and whenever I talk about investigations, almost in most of the conditions, the first investigation I talk about is CBC. So what CBC do? Whenever we order CBC in any patient, we get a report like this. CBC is, complete blood count, CBC, complete blood count. Uh, it is, there are different names. For example, it can be called as blood CP, or blood CP is what blood complete picture. So CBC, blood CP. Okay, some people they write CBC with differentials. So what is CBC with differentials? Like they tell you how much is the lymphocytes, how much is the monocytes, how much is eosinophils, and how much is basophils. So simply they give you the differential counts as well. So see, whenever we are going to diagnose any condition, we go for CBC, and CBC tell us or guide us a lot about diagnosis. For example, if you're suspecting anemia in someone, and the first thing which we will be looking at is RBC count. Okay, if you are going to doing CBC, for example, in someone and who have fever, who have infections, so we are going to check these cells. Either neutrophils are raised, either lymphocytes are raised, either eosinophils are raised. Like depending on, it will guide us, either it's a viral infection, either it's a bacterial infection, either it's some sort of allergy, things like this. So whenever we do CBC, uh, we get like a report like this. Like they tell us how much is the RBC count, and it's very important, guys, to remember these values, by the way, because uh, see, these are the normal values. Okay, these values are written like in different books. There is a little change, little difference is there, but more or less, all of them, they are correct, of course. For example, what is uh, this is complete blood count. So if see, the first one is WBC. Okay, so what is WBC? Is like, it is white blood cells. So normally, you can remember the range. Here it is written like 4,000 to 10,000 per millimeter cube. Okay, uh, you can write the same thing as, for example, 4.0 to 10.0 multiplied by 10 raised to the power 9 per millimeter cube. So of course they are the same thing. Uh, so this one, in some of the books, it's written like 4,000 to 11,000. That's also correct. Even like whenever I remember the values, of WBCs, I remember it in this way. Like the normal value of WBC is 4,000 to 11,000 per millimeter cube. And after that, they tell us the differential count. Like neutrophils, out of them are around 40 to 75. Okay, or you can say 1,000 to 7,000 cells per millimeter cube. Or lymphocytes, these are the percentage. So simply it could be anything from 700 to 4,500 cells per millimeter of cube. And monocytes, they are quite less. So they could be any number like 1,000 to 100 to 1,000. See, 1 to 10%. So we have to take 1 to 10% of this thing. Okay. So they range from anywhere between 100 cells to 1,000 cells per millimeter of cube. The same thing with eosinophils. They could range from anywhere from 0 to, you can say, it's written 6, so you can say 600 cells per millimeter cube. And basophils, somewhere between 0 to 200 cells per millimeter cube. So of course, like here it is written in percentages. If you want to convert these percentages to numbers, you can simply make the calculation and you can change it. So this is like about WBC count. Then of course they give you how much is hemoglobin, RBC count is there, like how much is the RBCs in the blood. So see what's written over here. It's 4.2 to 5.9 million per millimeter of cube. So it's different for the females and different for the males, by the way. So hemoglobin, simply how much is the oxygen carrying protein is there in the blood. Okay, because when the hemoglobin levels goes down, it can lead to anemia. So hemoglobin, see in the males and females, they have given the values. Okay, so it is like 14 to 18 gram per deciliter, and or you can say 12 to 16 in females gram per deciliter. So some of the books they write 13 to 18. That's also correct. Doesn't make any difference. In females, when the females are pregnant, this one is not the normal values. Rather, in females there is, during pregnancy there is hemodilution. Their blood become diluted. So when their blood become diluted, so this value is like 11. So in females who are pregnant, anemia is when their RBC is like their hemoglobin is less than 11 gram per deciliter. So again, that's a different discussion, by the way. So hematocrit, you can see over here. What is hematocrit? Hematocrit is percentage of a given volume of blood which is occupied by RBCs, by packed RBCs. If you will take blood, you will centrifuge the blood, so the RBCs are going to settle down. When RBCs are going to settle down, so they see like how much area is grabbed by RBCs. Of course, that is the percentage of the area which is occupied by RBCs. So simply, hematocrit can be defined as it's a percentage of a given volume of blood occupied by packed RBCs. So in males and females, again, there is different values. You can see over here. And in different books, the values can be a little changed. So until and unless it is coming from any authentic source. So that's correct. And there is a lot of lab variations as well. So that's a different discussion. Then see, they give you MCV. What is MCV? It is mean corpuscular volume. Now, what they do is they measure the size of the RBCs. And when they measure the size of the RBCs, it's not like this, like they measure what you can say just one RBC, rather they measure different RBCs. Okay, so once they measure, they take the mean of that. Okay, so they are measuring in this one the volume of RBCs. Okay, and after measuring what you can say volume of different RBCs, they take out the mean, and that what they call it as mean corpuscular volume. Now this is something very important. Why? Because they like anemia. We classify them in what you can say on the basis of what is the size of RBCs. The size can be smaller. The size can be like same like the normal RBCs, or the size of the RBCs can get bigger. So what happens is, you can see over here, like this is what they are right, like what's written over here. It's like 86 to 98. femto, okay, femtoliter per cell. So this one, uh, this one is what you can say, the normal size, okay. And many of the books, they write it as 80 to 100, and I think like that is easy to remember. 80 to 100 makes more sense to me. So anyone whose MCV come less than 80, we know like the now the size of the RBCs is less, so we call it as microcytic, small, micro. Whenever the size come back more than 100, we call it as macrocytic. And when the size is in between the normal value, like which is 80 to 100, uh, we call it as normocytic. You can see over here, like here the values are also given, and MCV, see here, is 80 to 98, okay, femtoliter. So uh, anyhow, like, but if you can remember this one, this is also correct, but 80 to 100 makes, well, like, it's easy to remember. So when they give you the CBC report, they also give you MCH. What is MCH? It is mean corpuscular hemoglobin. So what is this one? This is you can say how much hemoglobin is there in the cell. Okay, so they measure that, and they give you the value. So when we will discuss anemia, I will talk about this thing. What you can say, what is the importance of this thing. So you can see over here, in this one it's written 27 to 32, okay. One of the value which you can remember, it is 27 to 32 picograms, okay. It is 27 to 32 picograms. Here there is some mistake, okay. So it is 27 to 32 picograms, pg, okay. So you see this one, 27, see here it is 34. So that's why I explain you this thing, that you will take Oxford book, you will take Davidson, you will take PJ Kumar, you will take Harrison, you will take maybe Kaplan's, you will find a little variation in the values. So anyhow, they are all are correct. So so simply, this one is the mean hemoglobin in the cell, this one is the mean volume of the cells. Then one thing they give you is called as um, okay. Other than MCH, they give you one more thing that is called as MCHC. So what is MCHC? It is a mean corpuscular hemoglobin concentration. Okay, so simply the same thing. They are giving you the answers in percentages. Okay, so that will make how much concentration is there, or simply what is the average concentration of hemoglobin inside each RBC, and the normal value is around 32 to 36 percentage is there. Then one of the thing which they give is RDW, which is uh, red blood cell distribution width. So what they do, by the way, is simply they when they measure this one, MCV. So for example, if someone RBCs, someone have, for I can give you the example, someone have a mixed anemia. He have a microcytic anemia as well as macrocytic anemia. So what will be the complete picture of his blood will be that some of his cells will be smaller size, whereas some of his cells will be bigger size. So, uh, okay, when they will check, for example, different cells, that some of the cells are normal size, some of the cells are bigger in size, then they will take out the mean of that, and they can give you this value. But how much variance is there? How much difference of sizes are there? Or how much different size of cells are present in one sample of blood? When they measure that, they give you this thing, red cell width distribution. Okay, so normally the variance is around 11 to 15%. Here it is written 11.5 to 14.5. Here it is written 11.7 to 15. So that's why, to make it easy, you can remember 11 to 15%. Okay, so what values I'm talking about, I'm saying like you can remember by this way. It's not like I'm making from myself, rather I can give you references like many books. They give the same values. So red cell distribution width is simply defined as it is the variance in RBC size. Simply, guys, if someone have microcytic anemia, maybe all of his cells, RBCs in the blood, are smaller size. But if someone have, for example, a newly onset microcytic anemia, so maybe in his cell in the blood, you will find many cells are small, but many cells will be normal. And one more example, if someone have a microcytic as well as macrocytic anemia, a mixed, like two type of anemias in the same person, some of his cells will be very small in size, but some of his cells will be very big in size. So that information we get from here. Of course, if his smaller cells will be more, then his MCV will be decreased because it's the mean of the volume of different cells. But for example, if he have more bigger cell size in his body, so his MCV will come back as more than 100 because it's the mean. And if the bigger cells are more, so the mean will be increased. But maybe this is the condition that the patient may have both smaller as well as bigger size. So when they take the mean of both, so this value come back as normal, which can mislead us that the cell is of normal size. We check this one. If this value is a normal range, then we believe, okay, now the cells are in normal size. But if this value is not in the, you can say, normal values, it means that there is a lot of variance in the red blood cell size, which means that we cannot go on the mean corpuscular volume because the mean is coming as in the normal values, but in reality, there's a lot of small as well as bigger cells are there. Hope you get the point. So these all are the things which they give us the information about. Then they give us the platelet counts. Very easy to remember. You can remember this value, it's also correct. You can remember until 450,000, that's also correct, per millimeter of cube. Many of the labs, maybe you will find over here. Okay, many of the labs can also give you MPV or mean platelet volume. Uh, Not have much clinical importance at this stage. Okay, but they can give. One very important thing which is not written over here, but I'm sure it should be written here, is called as reticulocytes count. Reticulocytes count. I couldn't find it here. Okay, what is reticulocytes? Reticulocytes is basically immature cells, immature RBCs, and what you could say, reticulocytes um, are immature RBCs, and of course, like first the body start making reticulocytes, and then they get mature and change into RBCs. So reticulocyte is a very important investigation in many type of anemias, because if reticulocytes are there, which means body is producing RBCs. But if reticulocytes are absent, what it means that the body is not making RBCs. Okay, I spent a lot of time on this slide, but basically, I'm sure you guys had done lab diagnosis, of course, in all that one. Um, you guys have learned this thing because when I teach to other session, lab diagnosis, I teach them all these things. So, uh, how to interpret this one, we will of course discuss again and again when we will discuss different conditions. So I told you about microcytic, normocytic, macrocytic, and then there is what you can say the few more terms. I'm sure like many of you are familiar with that, but just for revision, I'm going to talk about them for a while. not too much, taking not too much time, because this introduction lecture is getting too much longer. Um, you can say uh, you will find terms like this thing, for example, microcytic uh, or macrocyte or normocyte. Of course, like, what are these terms, right? Normocytes. So of course, like microcytes, macrocytes, or normocytes. It means like smaller, bigger, or normal size. Um, oh yes, yes. For example, if someone is coming with increased RDW, it means like there is a lot of variances in size, which means like maybe we are getting a report like MCV is normal, but what it means, if RDW is raised, what it means, like there is a lot of macro as well as micro cells which is giving this picture, but the RDW is raised. We call this condition as anisocytosis. So when there is increased RDW, these cells are also called as anisocytosis, which means that there is a lot of variability in size of course we are dealing with RBCs. Okay, so this is RDW. Then you will find a term called as hypochromic. Of course, when the color of the RBCs is like pale, like in anemia. Um, there is a term called as polychromasia, in which like there is different colors of cells. Poly, remember this thing. So this is about size, this is about color, and there is about shape also. If the RBCs are of abnormal shape, so we call it as poikilocytosis. Okay, so if you will read this term anywhere, what it means, like there is abnormal shape RBCs in the body. Okay, so poikilocytosis, it means like there is abnormal shape of okay. And yes, when we are talking about abnormal shape, I can show you some abnormal shapes over here. See, microcytic, this is the normal, just for reference. And here it is written, cartoon image, but it's quite funny, by the way. And see, this is microcytic cell, just for a reference they are showing you. And these are the causes, of course, when we will discuss the causes. Then there is macrocytic, bigger size. Then there is spur cells. What is spur cells? Simply, they are called as acanthocyte. Acanthocyte is spur cells. They have spikes like this. Okay. So simply, what is spur cells or acanthocytes? These are, you can say, they have these spike-like projections on them, and which is basically due to abnormal membrane lipids. Okay, and see, when this is the case, and they are measuring RDW, what they will found that they are randomly distributed because of spikes. RBCs cannot come near each other. Then there is Bursa, which are also called as echinocyte. So in this one, what you can see, like you can see small spiny projection. These are like spurs or spikes. These are small projections you can see over here. Okay, like this happens in uremia, especially. Then there is schizocyte, and schizocytes are also called as helmet cells. See, they look like a helmet. Okay, so they are also called as helmet cells. And basically, what they are broken cells, or the fragments of a normal RBCs, like they get broken and they appear like this one. So uh, these are called as schizocytes or helmet cells. Okay, fragmented RBCs, broken RBCs. Then there is bite cells. See, a cell, and it looks like um, it's bitten from one side. Okay, so this one occur in some hemoglobin disorder in which the membrane is not stable. A elliptocyte, in which the cell is oval shape. Elliptocytes are also called as ovelocytes because the cells are elongate, elongated oval shape. So simply, when the RBCs act long axis is 2 times more than the short axis, we call it as elliptocyte. When it is less than 2 times, then we call it as ovelocytes. But more or less, they are the same things because they have the same causes. Then there is spherocyte, in which the cell become like a ball. Okay. In reality, the normal shape, it's a biconcave type of shape. Okay, it's not a ball, but in spherocyte, it become a sphere. It become a ball. Why? Because the membrane loss have some problems, some hereditary problems. You can see over here, hereditary spherocytosis is one of the cause. So they appear ball shaped. Stomacytes, not so important, but in liver disease, they are seen like this way. You can see over here. Then there is target cells. Now, this is like they are also called as codocyte. These target cells are also called as codocyte, CODO, codocyte. So they're also called as bull eye, because see they look like a bull eye, the dart game which you play. So it occurs in many of the liver conditions. Yeah, here it is written over here. Then sickle cell. I think all of you have heard what a sickle cell anemia. See, basically the RBC is a sickle shaped. Then there is teardrop. Teardrop RBCs are also called as dacrocyte, because dacro is the tear. The medical word for tear is dacro. So that's why they are also called as dacrocyte. So simply you can see over here they have one edge, one side is pointed or the other one is curved. So it looks like a tear. So teardrop or dacrocyte. So sometimes there can be some crystals in the RBCs. You can see over here hemoglobin C disease. You can find the hemoglobin crystal. RBCs, they form Rolex formation, as well as they can clump together in many autoimmune conditions. You can see over here. And Rolex formation is also there in many liver disease. Okay. Pregnancy, pregnancy is the most common cause of this Rolex formation. So what are they? Basically, they are aggregated RBCs, which like in beads, or you can say stacks. Okay, so uh, in pregnancy there is increase of fibrinogen, so that's why we see this Rolex formation in pregnancy. Okay, and many other conditions like inflammatory conditions neoplastic conditions like multiple myeloma. You can see these kind of Rolex formation. So, maybe like many of them will not repeat again, but just for information, how different type of RBCs are present. Okay. So remember, guys, the mature RBCs, they don't have nucleus. Okay. So when they don't have nucleus, of course, they carry the stuff needed for 120 days, 90 to 120 days. Once when you don't have nucleus, there is no translation, no transcription. So what happens? Yeah, all the luggage which you have, for your survival, once that luggage is over, like you are going to die. So the RBC story goes like this way. When they are formed, when they are immature, they have nucleus. But once they mature, they don't have uh, nucleus. And in hematology, whenever there is a word blast or blast, BLAST, it means immature cells. So if I will say erythroblast, what it means, like immature RBCs. So a nucleus is seen in immature RBCs or erythroblasts, and once they are mature, uh, the nucleus, it goes away. So uh, like this is one of the thing, like whenever we see this thing, sometimes you can see over here like this hemoglobin which is seen over here, or we can see as a crystal, or we can see as a collection. uh, so basically this is denatured or precipitated hemoglobin. So it can be seen in different conditions, like it is called as Haynes bodies. Haynes, Heinz, Haynes bodies. Okay. I can write over here Heinz, Haynes bodies. Okay, so basically, if you remember, there is a company also called as Haynes company, right? So I remember it by that way. Okay, so it's like Haynes body is there. So now Haynes bodies are present in Heinz and bodies. Okay, so they are basically denatured hemoglobin. Okay, they are denatured hemoglobins. Sometimes we can see small, like in the normal RBC, in the RBC, we can see a small dot, which is basically, you can say, the a small type of nuclear material which is left, when the, like when an immature RBC have nucleus. So when it get mature, sometime a small part of the nucleus still persists in the body, sorry, in the RBC. In that case, it is called as Howell Jolly. I will just move it over here so that you can see clearly. So it is called as Howell Jolly bodies. Okay. So you can Google this thing. Okay, how it looks like Howell Jolly bodies. So why this thing is important? Because this is seen in the patient in which either the spleen is not working, or either the spleen is removed, or simply post splenectomy patients. We see Howell Jolly bodies, or in the patients who have hyposplenism, like their spleen is not working. Sometimes in the RBCs we see some dots of blue color dots. Okay, so that blue color dots, because blue color or purplish color type, basophils or basophilic staining, we call it as basophilic staining. So basophilic staining or stippling, small dots. So these are basically blue, or you can say purplish granulations, which are basically ribosome aggregations. Okay, so in many of the heavy metal poisonings like lead, you can see that basophilic stippling. A very important point. And by the way, nowadays, lead poisoning is not so common, because it was common in old days, when the paints, they had a lot of lead in that. Nowadays, this lead poisoning is not important, but remember, in heavy metal poisoning, for example, zinc, lead, there's this basophilic stippling can be there, small blue or purplish dots. Thalassemia, it can be there. Then one thing is called as sideroblasts. So in sideroblasts, what happens, that in RBCs there is iron, okay, which can be seen by microscope. So when the RBCs have as iron remnants or iron granules, we call them as sideroblast cells. Okay, so we call them sideroblast or sideroblast cells. So what they have small in their cytoplasm, in the cytoplasm of the RBCs, they have small iron granules. Okay, like it occurs in many, there is a anemia called a sideroblastic anemia, in which they can be seen. And what are the causes? Like it could be idiopathic. There are certain drugs which can give this thing as well. So anyhow, like these are the few things which I wanted to talk about. And when we will start the, what you can say, uh, leukemias and lymphomas, which is more related with the white blood cells. So before starting that, I will show you different type of RBCs, which can be, which you can see over there. Okay, in the under the microscope. So that's about, what you can say, the cells. So I will show you different cells, like there is Reed-Sternberg cells, which is present in Hodgkin lymphoma, and many other type of RBC, WBCs. Okay, so that when we will start leukemias and lymphomas. So as I told you about the lifespan of WBCs, other than the lymphocytes, which stay for quite long. Neutrophils have a very short lifespan. So normally, like most of the neutrophils when we see under the microscope are like mature neutrophils, which have what you can say 3 to 4 lobed like nucleus in that we can see, and they are found in circulation. So what you can say, blast, whenever like you will found, for example, a lymphoblast or wherever the blast is there, remember they are immature cells, okay. They are immature cells, and like the importance of these blast cells will come in leukemias and lymphomas, okay. When we will discuss that, what you can say, we are going to discuss that more. Other than that, guys, because like this is some sort of introduction, rather I should change the name of this lecture as intro uh, introduction to hematology, introduction to hematology, right? So like um, I will talk about what's left, like what I was thinking. Yes, okay. So see, when we are going to discuss what you can say hematology, uh, there are these are all the conditions which are related to blood. Uh, See, we see the sign and symptoms of the patients. What happens is, for example, if a patient will come to me and I will see that he have decreased capillary refill time, his palms look so pale, his eyes uh, uh, look so pale, the eyelids I'm talking about, what the doctors see, look up and they see uh, under the skin of the lids, so if for example they are pale, uh, if the person is pale, if the person have for example palpitations as well as dyspnea and chest pain. So see, I will start thinking about anemia. So I'm getting the things from the clinical features. If someone lymph nodes are enlarged all over the body, I will start thinking about lymphoma. If someone is getting too much infections, and I can see like he have a lot of petechias, which are small bleeding spots on the skin. So, and he's losing weight, for example, he have anorexia. So I will start thinking about leukemias. Um Same like this thing. Like we see the clinical features. Same, we take the history. We see the clinical features, and then we think about differential diagnosis, and then we go for exam investigations. So investigations like in blood, of course, like CBC should come number one, and uh, we'll keep on discussing all this investigation during the course of different conditions. So we can do CBC. If it's we are suspecting anemia, we can do iron studies, okay. We can do vitamin D, B levels, we can check the folic acid levels, we can check the differential count, okay, can be done, and we can do LFTs, okay, which are the liver function tests, like clotting factors. We can do renal function tests to check the kidney, because the kidneys, if they are not working fine, so they can be losing proteins, and when the kidneys will start losing proteins, we can lose a lot of clotting factors. We can check for clotting factors, or we can do clotting profile, okay, of the patient, just to see how the things are going. So a lot of investigations are there. Uh, then there are some interventional studies as well in this one. For example, you can do biopsy of lymph nodes. Okay, you can do biopsy of the lymph nodes, for example. You can do yes, one very important investigation, bone marrow biopsy. Bone marrow biopsy. Bone marrow biopsy, of course, bone marrow biopsy is you can say it's always the last resort in hematology, when you want to confirm, or when you want to see like what exactly is the condition of the bone marrow, then we go for bone marrow biopsy, because it's quite interventional type of investigation, in which take a trocar and they take a sample from inside your bone marrow. So like the preferred site is always, like either they can take from sternum, or either they can take from the iliac crust of your hip bone, iliac crust. So what happens is, of course, like we take the bone marrow sample and when we send it to the lab for any type of studies. For example, we can ask them to count the cells, see the cells, what cells are present in the bone marrow. One thing is called as flow cytometry, or we can do genetic studies on that. If we are suspecting some infection, we can ask them to do culture and sensitivity, and or simply we can ask them to see how it looks like, or what is the real meaning of biopsy. We can ask them to see the either there is any pathology present in that bone marrow or not. So this is like quite an interventional type of study, but most of the time, in the diagnosis of different carcinomas, for example, leukemias, there is a lot of plasma cell disorders. There is something called as myelofibrosis, or there are certain type of storage diseases like amyloidosis, in which like that one infiltrate the bone marrow. Uh, Sometimes, if someone have fever of unknown origin, a topic which we had already covered. So in that one, like if you want to know like either there is some problem in the bone marrow, you can take a sample directly from there. Okay, so this thing, okay, many of the hematological problems can give splenomegaly as well. So splenomegaly is a very, very, very important part of the examination of when you are examining any patient from the point of view of hematology. So we always check their liver is enlarged. We always, whenever we examine any patient, uh, what you can say, for any hematological problem. So other than doing the general physical examination, taking the vitals, looking the hands, and looking the face, and all this thing, few of the areas which we concentrate highly is basically uh, we like other than these things, we always go for lymph node examination. Okay, so what are the important areas where we can check the lymph nodes? See, there is submandibular, submental, I'm talking about the face, preauricular, postauricular. Then there are lymph nodes in your neck. Cervical chains are there, deep cervical chains are there, posterior cervical chains are there. Then there is lymph nodes supraclavicular, in the supraclavicular region. We check there. There is lymph nodes in the axilla. There is lymph nodes behind the elbow. There is lymph nodes in the inguinal region. There are lymph nodes in the popliteal region. So whenever we examine any patient from hematological point of view, we always examine all the lymph nodes. Then we always examine the liver, and we always examine the spleen. Okay, liver examination is done, and spleen examination is done as well. Okay, whenever we examine anyone from hematological point of view. Other than that, we always check for bone tenderness all over the body, because in many type of what you can say malignancies, maybe you will find tenderness in some sites where hematopoiesis is occurring. Okay, so bone tenderness can be there. So like that's why, like keeping all this thing in mind, we always do this type of examination. Okay, so history, examination, investigations, rest all the things remain same when it comes to the hematology. So of course, like this was the introduction or the basic introduction of hematology, and then of course we will start discussing anemias. Once anemias will be done, then we will go on to anemia is a very, very huge topic itself. So we will be studying anemia. We will be studying hemostasis, or you can say bleeding disorders. Okay, so in bleeding disorders we will discuss all the platelets as well as clotting factor disorders which can be there, and then we will discuss the malignancies, simply myelomas or leukemias and lymphomas, and that's it. Like in these three main domains, well, like we are going to cover all the important topics which are related to hematology. Okay, so that's all about this one, introduction of hematology. Thank you.